Hello, my name is Dr. Sarwar Chaudhry. We are going to talk about pulmonary embolism today. First, we will talk about what is pulmonary embolism. Then we will talk about its symptoms, signs, and then what investigations are required to confirm pulmonary embolism. And at the end, we will discuss the treatment rationale of pulmonary embolism. So pulmonary embolism is when there is a blood clot blocking smaller or larger arteries in the lung. These blood clots normally form most of the time in the pelvic or leg veins and travel with the blood flow through the right side of the heart into the lungs. Sometimes these blood clots can also form in the upper arms. So when this happens, the blood flow to the part of the lung is compromised and can cause variable symptoms. Talking about symptoms, the most common symptoms of pulmonary embolism is a new onset of sudden one-sided chest pain, which we call the pleuritic chest pain, which is worse on deep breathing or coughing. It is usually associated with breathlessness. If the clot is large enough, it can cause palpitations, dizziness, and syncopal episodes. If it is suspected that a person may have pulmonary embolism, we may do a clinical assessment initially, followed by biochemical, but more important, radiological investigations. So if patient got obvious signs of blood clot in the leg or veins and present with such symptoms, it makes them very high risk of having pulmonary embolism. We can perform sometime blood test called a D-dimer. When it's positive, it has got a good positive predictive value. And if it is positive, then we need to confirm the diagnosis by doing a radiological test. Radiology tests can be divided into two forms. One is a CTPA or CT pulmonary angiogram, which we can do by giving a contrast agent through the veins and doing a scan, and it will show directly the clot blocking larger or smaller vessels of the lungs. It will also show any changes to the lung structure along with the blockage in the blood vessel. It can also give some other useful information. Other tests which we can do is a VQ scan, which is a nuclear medicine scan. It's normally done in people who cannot have a contrast agent due to allergy or very poor kidney function. We may also need to do an echocardiogram to assess how the heart is coping against the blood blockage. Talking about the treatment, which is anticoagulation, the medication that stops clotting inside the body. These anticoagulation medication do not dissolve the blood clot, but prevent any new clot to form around already formed clot, and the clot itself dissolves away in a matter of few days. This is most common treatment. If the patient has a significant stress on the heart, we can use a thrombolysis medication, which dissolves the blood clot and restores the blood flow quickly. It has got a side effect of causing a hemorrhage, especially in the brain, which can be life-threatening. So we only use if the patient is compromised due to pulmonary embolism. It is also important to understand the reason for pulmonary embolisms. The most common reasons are post-operative patients, especially with the knee or hip surgeries or any prolonged abdominal surgeries. Patients with acute medical problem who are hospitalized for long also at increased risk and should receive prophylactic anticoagulation. If a patient has got no obvious risk factor, then it may be underlying no reasons, or sometimes even a cancer can be the reason for a new pulmonary embolism. If there are any symptoms to suggest that, it may need to be investigated further. So if you have any symptoms suggestive of pulmonary embolism, it's a medical emergency and you should present to the nearest hospital as soon as possible to get assessed and treated effectively. If you have not subscribed to our channel so far, we would advise to subscribe so we can keep you posted of different medical updates for your education.